Guys, welcome back to another episode, to Nobody's Talking Podcast. I am incredibly honored today to have Dr. Jeff Moore with us. He is a physical therapist. He is not only a regular physical therapist, he teaches manual therapy, spinal manipulation courses. If you're listening, what that means is he's a professional back, neck, spine cracker, as you might say.
Yeah.
Jeff, I would just want to give you a chance to introduce yourself, some of the work that you're already doing, where people can hear you.
Yeah, man, great. Like you said, I've been a physical therapist now for about 9 years. I teach quite a bit nowadays, so I teach about 42 weekends a year. So about the vast majority. I also teach with South College. Both I teach on the road with my own company with Evidence in Motion. So I'm out there quite a bit. Kind of covered all four corners of the country, just having a blast doing it. Just recently moved to Colorado from Michigan. So I was in Michigan. My brother and I had a clinic there for 5 years. I was in Bozeman. We had a clinic there for 3.5. And now we just moved to Colorado. So next year I'll be jumping into Tim Flynn's clinic here in the area. He has Colorado in Motion. So I'll be jumping in with Tim early next year. Right now, my wife and I are trying to kind of get a house organized and get everything dialed in here in Colorado. And when you're on the road 42 weekends a year, it can make logistics a bit more challenging. But, man, I love being out there. I love working with energetic people and just trying to change the landscape of what we do. Ultimately, like you and I talked off air a bit, it's about dramatically reducing pain and disability for folks who don't need to go any further than conservative care to solve the problem. And that's what it's all about, man. And if we undertreat early on and we don't get the job done, they're going to go somewhere else. If they go somewhere else, man, those places have more risk and more downside than anything we'll ever offer.
Could not agree more. And I think that's what we are hoping to be able to do through our medium and our audience in the podcast is to let people be more aware of the conservative treatment that's out there instead of there's a huge population that's just not even aware that conservative treatment has just as equal, if not better outcomes often than surgery. And
Yeah.
so we couldn't pick a better person to help us talk through that today.
Well, thanks, man. It's important to bring up, it's not their fault, right? It's not their fault. They don't have the message, and it just really chaps me sometimes, man, when people say, the APTA should do an initiative and nonsense. The APTA can't come know your community, man. Yeah. Like that's your community. If you're not getting the word out and you understand the relationships, you understand the mediums, you know whether or not they read the newspaper, social media. you know where your community absorbs their material. So when those people don't know what we do and they choose more expensive, riskier options because of it, dude, that's on us.
It is.
That's totally on us.
Well, and if anyone's listening, APTA is the Physical Therapy Association, our national governing board for physical therapy. So when Jeff's saying that, that's who we look to in terms of guiding our profession. So
yeah, and they do a great job. The problem is, I think we look to them for things that they simply don't have the capacity or the responsibility to do, right? We put them in a challenging position about they should be more effective with this and this. Like, guys, that's way outside of their wheelhouse. You got to own your community. If we all own our communities nationwide, if we all own them locally, we solve the national problem tomorrow. It's a matter of doing it.
Jeff, I'm going to come back before we end this, and I'm going to hit you with that question about what we can be doing to reach those people outside of that. But I wanted to play a little, almost like a role play game in that I'm coming to you. I'm a person off the street, just curious about what it means when someone says spinal manipulation. I think some people are familiar through chiropractic of what, have heard of the terms adjustments. I kind of want to break down a little bit what that means in general. I think for the average person, I just talking with friends, family, there's a lot of confusion. We get a lot of mixed bag of, oh my gosh, I just love when someone cracks my back. We get the, oh my God, you crack people's necks. Isn't that dangerous? We also get a lot of the, just in general, I know it feels good, but I don't really know why. Should I be doing that? Is it something that's okay to do on a regular basis? Someone who's an avid knuckle cracker, my knuckle cracker. Wow, that's a hard word, hard phrase to say. As a kid, growing up, my mom was like, "You're going to get arthritis if you do that." I think there are a lot of things that the science that we can apply, and we know through physical therapy. I think that the general public might not have as good of an awareness of why it's such an important treatment, when it's useful, who could use it, how do we make it the most effective that we can. So without going into too much detail of the science and physiology, what happens when you hear a crack or a pop that we know of so far?
Yeah, so we have to have a healthy humility about that, right? Because really we haven't visualized that yet in the spine. We have seen in the finger that there is some gas that bubbles out of the aqueous solution or out of the liquid form into the gaseous form inside of the joint cavity, but we have not yet translated that to your spine. We're still assuming that's probably what's going on, is that you stretch the joint in your spine. Whenever you stretch something to a bigger size, the pressure decreases. When the pressure decreases, things tend to phase change. So liquids become gases to different extents, and that can be accompanied by a sound. So really what's going on is you're changing the volume of your joints by stretching them. And when you do that, there's a phase shift between liquid and gas, and that's what the popping sound really is. We are assuming, Will, in the spine as we've seen in the finger.
Okay, great.
Yeah.
So essentially it's this shifting from a liquid to gaseous phase change. And as you know, from basic chemistry science, we know that there is a burst of energy change that happens, a transfer of energy during that. So theoretically, that could be the sound that's produced.
Yeah, I mean, it brings us back to the old ideal gas laws, man. It's back to PV equals nRT, man. Remember that from physics? Pivnert.
Yeah,
Pivnert, dude. Yeah, it's what it all comes down to. When you change the volume, the pressure goes down if nothing else changes inside the container.
Yeah.
And that results in a phase change. So, I mean, it's simple physics. And really, you know, we can talk more. But you asked me about the sound. That's what we're thinking the sound probably is.
Okay. One thing that I hear a lot of from fellow classmates and probably physical therapists out there, probably patients, general public, in your opinion, does the sound matter? The actual pop sound matter?
Yeah, you know when it matters, Will, is when it matters.
Okay.
You know, and what I mean by that is there is a certain subgroup of patients who have an expectation that the sound is a beneficial thing. And what we've seen from Bolosky and Bishop and George and Cleland is that when you meet a patient's expectations on something they believe is going to get them better, that seems to have a favorable overall correlation to outcomes. So I think there are some patients who that's an important part of the process. I think it's a much smaller group than we think it is. I think that really it's oftentimes the clinician who's hung up on it, not the patient. In that if you're a really disciplined clinician and you're doing a thrust manipulation to someone's spine and it makes no noise, but you reflexively stand them up and have a look at their movement, I think more often than not, Will, you're going to be really pleasantly surprised in how often their movement changes and their symptoms decrease in the absence of a cavitation. If you were to look at the actual published evidence, you'd see a couple articles from between 2006 and 2010 by both Tim Flynn and Josh Cleland that suggest that the cavitation sound is not linked to pain reduction and functional disability changes. But you got to have a healthy humility, man. They were both relatively weak trials. They weren't really powered for that. That wasn't really the study design. That being said, the outcomes were still that the cavitation sound did not seem to predict whether or not the person's pain and disability changed. So, is it needed? I think sometimes. Is it good to be able to deliver it when needed? Yeah, I think it is, man. Is it the be-all, end-all of reducing pain and disability with quick stretching? Absolutely not.
Okay. So it sounds like the important thing is kind of figuring out the type of person first, if that might be something that you think that they have that expectation for, keeping that in mind.
Yeah, imagine that with patient care, man. Imagine having to try to get an idea of kind of where the person's coming from and how they believe the process affects them. Yeah, believe it or not, that seems to matter a little bit.
It's like new way of thinking. Who would have imagined?
Mind blowing.
So continuing on this theme, a lot of people are nervous, skeptical of having their neck cracked, popped, what we call manipulated.
Okay.
Can you help us, for someone out there who, let's say they are having headache symptoms and have never even thought of having their neck cracked as a potential? I'm gonna avoid using cracked from here on out. I'm gonna say manipulated. So if anyone's
man, I'm totally cool with cracked. I mean, I think the general public doesn't use the word manipulated. They use the word cracked. Yeah. So by all means, man, if that's who we're trying to get the ear of, and I think we are, I think your listeners would appreciate that frankness. So by all means, crack is cool. Yeah.
Okay. So as long as you understand what the cracking is, yes. So someone comes in with a headache. What do you go through when you figure out would cracking someone's neck be appropriate? And then also, is it safe?
That's a big question. That's a big question. As far as the answer to really do that justice is quite long.
Okay.
But let's break this into two parts quick and say that you mentioned that people might have a fear of it. And I think the reality is the clinician has a much greater fear than the patient. So if you look at expectations data from Bishop in 2013, when they asked a current large group of individuals who had neck pain, what they believe would be really effective for helping them reduce their neck symptoms, number one and number two were massage and thrust manipulation, 87% and 75% respectively. So the vast majority of people that have neck pain want their neck cracked. They wouldn't want that if they felt it was risky. So I think a lot of times clinicians are actually projecting their insecurity and their lack of understanding of safety and how to manage risk onto the patient, when it actually the opposite is the case. The patient often desires it, and it's the clinician's fear that actually gets projected. So I do believe that patients are not nearly as fearful as we say they are. It's actually us who have a bias running in that direction that actually sets the conversation in that direction. So just wanted to clear that up. That being said, is it safe? Well, it depends on what you consider safe, Will. So our clinical practice guidelines from 2008 estimate that about this is John Childs, JOSPT, estimate that about 1 in 6 million. So the risk of an serious adverse event happening is about 1 in 6 million. Okay, I don't know where you draw the line to risk. To me, that's quite low. Louis Plantadura has a systematic review on whether or not we can reduce adverse events. In other words, can we prevent something bad from happening by doing a proper red flag screen, just a very basic red flag screen, and then only limit manipulation to individuals where the evidence would suggest there would be some benefit? The answer is yes. You can cut the risk in half by doing a proper red flag screen. Well, Will, we're at 1 in 12 million. I don't know where it is you have your line. To me, that puts cervical manipulation at a level of risk as safe as any possible, certainly much safer than vigorous exercise, certainly much safer than hot pack application. I mean, much, much, much safer than a lot of the other things you might do with the individual. So is it safe? Yeah, it's incredibly safe. Is there something to be said for doing a good atherosclerotic risk profile, a really good history to make sure there was no trauma to the vascular structures, and then to build your mechanical case? Because, Will, you got to realize, man, one part of it is making sure they don't have any vascular injury or dissection. And for your listeners, that means make sure their arteries aren't damaged, right? Make sure that's not the case. But then at the same time, you have to build a case that there is some joint and or muscle dysfunction going on in the neck that's causing the headache and or ipsilateral or unilateral or one-sided neck pain. When the two of those things go together, there does not seem to be an artery problem. There does seem to be a mechanical neck problem. The overall risk is 1 in 6 million, 1 in 12 million if you screen properly. Will, I think we've got a home run, boss. And I think it's us who are nervous, not the patient. 75%, man. The majority of people in the lumbar spine, it's 60. The majority of people who have spine pain want their neck cracked. There have been professions that have largely leveraged just spinal manipulation for a long time, and they've done really, really well. You want to know why? Because guess what? People want it. That's why. You can make up all sorts of really fun reasons. At the end of the day, you don't exist for 150, 125 years unless people want what you have. The answer is people do want it. We have data to support that.
Okay. I think, wow, powerful argument for one, it is the risk. I mean, you put it 1 in 12 million. We're talking about incredibly low odds.
I mean,
then I was going to say, so to take maybe a 2-minute side break of that is, for our physical therapy students and or fresh physical therapists, shoot, any physical therapist out there who has not been incorporating cervical neck cracking into their practice, where do you think that fear comes from? How do we help overcome that fear?
That's a great question. It's one I can't answer because I don't have their individual history, but I've got to think that it comes from, I don't want to knock on universities, Will. It's not what we're trying to do.
Right.
But certainly that's where they get exposed to the material. And I think sometimes programs pitch that as being a bit riskier than perhaps it is. And they probably have a myriad of reasons for doing that. Unfortunately, that initial sensitization to the material really tends to stick. And these individuals kind of get in that mindset that it is riskier, or they have this perceived level of risk that well trumps actual risk. And Will, as doctors, man, you don't make decisions based on perceived risk. you make decisions based on actual risk.
Right.
I mean, that's just not something that you do as a doctoring professional, right?
Yeah.
And so I think that's where a lot of that perception comes from. And let's not overstate the case either. I do believe there are people who get injured with reckless technique to vulnerable arteries. I mean, it's out there. But the reality is, man, again, as doctors, you don't get to avoid risk. You get to manage it.
Right.
That's part of the responsibility, dude. I mean, if you're going to see folks off the street and you're going to be seeing non-musculoskeletal origins of symptoms, you're going to have to make key decisions. This is one of those other key decisions. And if you're not comfortable in the gray, I would really suggest maybe at this point with where PT has gone as being a first access provider, this might not be your gig, dude.
Yeah. No, I completely agree. Just thinking about in general, a physician doesn't not give medicine just because there's a potential risk, right? You are finding what has the best potential with the least amount of risk, but there's always some degree of risk, no matter what we're doing when it comes to treatment, medicine, the human body, you name it. I can't think of anything that does not have a potential risk. That's just life, right? There are risks in everything. So Jeff, what I wanted to ask is, I just cracked my back.
Okay.
I am a 29-year-old male.
Did you really? Or are you making that up for the sake of the podcast?
I did just now. I was making it up for the podcast, but I did just now. I just cracked my back.
Yeah.
And I'm a 29-year-old male. I have terrible posture because I sit at a desk in class all the time. It just felt really good to crack my back.
Nice.
Am I good for a while? Is that all I need to do? Or is there anything else? I think there are a lot of people who just think, it feels good to crack my back. How do we make that the most effective? Is it just effective to do that on its own? Or is there anything else that we need to be doing?
Did you get some temporary symptom relief?
I did. I feel great.
Yeah.
Right where my neck meets my back.
Good. Now, the only problem is you and I both know you've only got about a window of 5 or 10 minutes right now, right? It's going to build back up. Why is that the case? The reality is, Will, the reason that individuals experience dramatic reduction in pain and disability following spinal manipulation is that when you take one vertebra and you move it a decent distance relative to the neighboring vertebra, that gives what we call a neurophysiological cascade of positive events, right? For your listeners, that means that fires a whole bunch of nerves that talk to the spinal cord and to the brain, and it results in a really significant cascade of pain reduction and muscle balance changes that are very favorable. But the key is it has something to do with the force in the distance of displacement of one vertebra relative to the next one. So your little leaning back on the chair maneuver there, while it got the job done to give you some noise because each thoracic vertebra has 12 joints that are capable of cavitation, you didn't really take one vertebra and translate it dramatically relative to another because you don't have the leverage, right? So that's why you're only going to get 5 to 10 minutes. Whereas if I was able to crack your back or somebody else was able to crack your back and put some significant velocity and force into it, you would experience a much more dramatic pain reduction that stayed for a longer period of time. Because what we've seen in the research is the force and the velocity and the distance intervertebral seems to correlate to a more dramatic neurophysiological cascade. So is it fine for you to do it? Yeah. Is it effective? Not very. And you know that, and I know that, and so does everybody else. It's why when they come in and say, it's funny that helps so much because I do it all the time. Well, you sort of do it. You bring it to the point of getting 1 or 2 clicks and pops. You do not really move one vertebra very much relative to the next one. Thus, the overall nervous system effect when you do it is fairly limited. When I do it, it's fairly significant.
Awesome. So for a listener out there, there is a major difference between I'm going to crack my own back, it feels good, versus I'm going to go to someone who can apply that force in a specific direction. That's the difference.
Totally. And where you can do it. So if you think about if you were to break a stick, this is actually a terrible analogy to utilize for spinal manipulation. But Will, if you were to break a stick, if you were to grab a really dry stick in the middle of summer and someone said, Will, I want you to break that stick, where would you break it? What would be the easiest spot for you to break it?
I would imagine the middle.
Right in the middle. Why is that? There's a really big lever arm on both sides of the break, right? So it's very easy for you to self-manipulate C4-5. For your listeners, that's the middle of the neck, the middle of the thoracic spine, the middle of the lumbar spine. It's very challenging for you to truly manipulate C1-2, C0-1. It's very hard to break the last inch off the stick. It's very easy to break the stick in the middle. So the issue with self-manipulation is you can't actually localize it to where your actual joint dysfunction is that would most dramatically respond to the manipulation, because you don't have the lever arms available to truly localize that movement. So not only can we give you a greater intervertebral motion, we can give you better localization. Is it perfect? No. Is it within 2 vertebrae? Yeah.
How important is exercise post thrust manipulation or cracking of a joint?
You know, the popular answer right now would for me to be say, oh, it's absolutely critical, Will. If you don't do the follow-up exercise, the whole thing is pointless. I don't fully agree with that in clinic.
Okay.
And I say that, man, because a lot of cervicogenic headaches have come in who we've cracked the upper neck a handful of times, and I've seen them 6 months later at the grocery store. They've said, dude, headache free. You know, and you never really gave them much, or you gave it to them and you said, hey, did you follow up with that? And they said, Jeff, I never do that, man. I never do it because I never had another headache. Yeah. Now, that being said, Will, that's a small subgroup. In most cases, if you can get more guns on it, dude, get more guns on it. Right? Generally speaking, the manual therapy literature suggests that when you combine exercise and manual therapy, it has a better effect than exercise alone. There's systematic review level evidence supporting that. Is it excellent? No. Is it out there? Yeah. So, I mean, in general, I think that when you get your hands on somebody, both for self-efficacy, for them not having the feeling that it was all passive, that it was all the operator who fixed them, that they were part of the process, I think mentally it's a healthier way to go about it. And I do think from both a logic perspective and a subtle support in the research that combining exercise with manipulation is more advantageous than one alone. But do not underweigh the ability for your hands at the right time in the right place and the right patient to have a very profound effect.
How do you feel about physical therapy? I think there's a lot of people out there who aren't aware that we even treat headache symptoms. Do you see us in the future? And so if someone's listening out there and they have a headache, you know, obviously if it's very severe, you know, see whoever you can get into first. But what do you feel? How do you feel our role as physical therapists is moving towards dealing with treating headaches and migraine symptoms, anything along those lines?
Yeah, so I routinely say at my courses, Will, the number one area that physical therapists can have the most absolute dramatic within session and between session changes, meaning to your audience, the most immediate and dramatic effect is headache. Headache and TMJ. Those are the 2 areas that you can have almost a miraculous type effect. I'm not in love with that word. I don't like thinking about miracles. I don't like even talking that way, but you can't deny there are times that people come back and say, dude, I have had a headache daily for 4 years. I've seen you twice, and I have not had a headache in 6 days. That is bordering somewhere on mystical and or miraculous. Why is that the case, man? Because the spine is more densely afferented as you move up, right? What is the most densely afferented region of your spine? Upper cervical. Why? Because your brain is going to keep your eyes level to the horizon no matter what. That's survival, right? So the righting response demands that you have tremendous afferentation or input from the upper neck to your brain so you can make subtle changes to keep your eyes level to the horizon. Well, that just happens to be tremendous tools, man, when we get our hands up there and we have an impact. That impact is magnified by the density of those afferentation proprioceptors. So in the upper neck, we can multiply our effect because we're more densely innervated. So in the area of headache, we can have a more dramatic effect than we can in the lumbar spine, simply due to density of afferentation.
That's awesome. And for anyone listening, you know, it's not that physical therapy is always going to be the answer to solving a headache, right? We've talked, and Jeff and I have talked off air, and I've if anyone's out there, you definitely have to listen to his Institute of Clinical Excellence podcast. If you are up early in the morning, his Periscope sessions, cool. You can watch it. You can watch the replays too. But he had a great video about sort of what we call contraindications or things you need to look out for, red flags, so we don't do things. And one-sided headache constantly kept coming up. But I think people don't even probably think of us often as someone to go to directly for potential treatment. And so something to keep in mind if you're out there having a headache. Physical therapists have direct access, someone you may consider seeing, and we're able to screen to send you to somewhere else if the red flags show up. I was going to have you, Jeff, I'm going to put you on the spot here, but can you think of, and not to glorify thrust manipulation or cracking, as we say in the neck, can you give us an example? You've given a few already, but can you give us an example of a time where really you saw a major in-session change from some type of, whether it's cracking back, neck, you name it?
Yeah, man. I mean, that in the neck. So I really, at this point in my career, treat predominantly spine pain. So I treat neck pain, jaw pain, and back pain, simply because it's where my expertise is sort of developed. So so I have a lot bigger sample size on the question that you're asking me about than the average PT would. So often, one could say daily,
Wow.
and when that happens, Will, is when they meet the criteria for having a cervicogenic headache, right? So the International Headache Society originally gave the final criteria, or the initial criteria, where they sort of officially said, hey, there does indeed seem to be a very specific type of headache that originates from the neck. That was in 1988, right? So that was where they finally, they resisted that for quite a long time. And then finally came out and said, you know what? There does seem to be a specific headache subgroup where the issue is actually in the neck that's causing the headache. And now we know a lot more about why that is. We know there's a common relay station called the trigeminal cervical nucleus, where the trigeminal nerve from the head and face comes in and meets up with the upper cervical nerves, and they meet in one nucleus before they project up to the brain. So the brain's not exactly sure where that signal is coming from. So we now know there are individuals, many of them, right, 20-25% of headache that's coming from the upper neck versus another source, be it migraine, tension, cluster, etc. So when somebody meets the criteria, so what are those criteria? Well, it's somebody who has one-sided headache that generally starts in the back of the head and goes forward, is accompanied by neck pain and stiffness, gets worse with prolonged weight-bearing static postures, right, and does not switch sides during episode. Right, so individuals who have a predominantly one-sided headache that gets worse when they're sitting in the same spot for a long time, and they have neck stiffness and pain that accompanies it, those are the individuals that tend to respond dramatically and consistently to thrust manipulation to the mid and upper neck.
Awesome. And to clarify, I think I messed up earlier in saying that the one-sided was a contraindication, a red flag.
No. You made a great point, because you're absolutely right. When arteries are damaged, they also refer to one side. And that's why we have to be prudent as practitioners when we see one-sided neck pain and headache, to make sure that we have a vascular suspicion and that remains an arterial problem until we've ruled it out. That's just prudent practice.
Awesome.
Yeah.
Awesome. So, Jeff, I wanted to come back, if you have a second here, to answer the question earlier about how do we get out to these people, to our audience, to the population as a whole, about reaching out to people who are having this type of pain, having chronic pain. What are some things that we can do to help sort of shift this? And maybe not even just from purely physical therapy, but in terms of healthcare in general. Dr. Sharon Dunn, the president of the APTA, recently posted a link to a journal from the JAMA, saying that, study shows, I'm blanking now if it was, for meniscal surgery, it showed that conservative care was equal, if not better than meniscal tear surgery. So replacing having surgery on a meniscus, which is in the knee. And then it made me think, though, like that's awesome. That's great for our field. It's great for people. Anytime you can avoid having surgery, that's great. But then I had this thought of there are a lot of people who probably aren't going to read that. How do we get that out to the population?
That was very kindly said, Will. You're right. Not a lot of folks are reading JAMA with their morning coffee. Yeah, you're right. Dude, that's the most common question I get, and it's the one I have the hardest time answering, because I don't see the barrier. I mean, you meet people where they are, right? In Michigan, every week we ran a full-page newspaper ad that gave specific information about what physical therapy does to treat different symptom behaviors. We are on the talk radio on a regular basis. We were at every triathlon and every wellness fair possible. We screen patients at the YMCA the first Thursday of every month. We were heavily on social media, Facebook, Twitter, Instagram, you name it. Dude, just tell people. We have every medium available to us. The information is in a landslide in our favor. In the vast majority of neuromusculoskeletal impairments, we are the practitioners of choice for both cost and efficacy. Dude, how hard is that to sell? I don't know where the problem is, dude. We just told, if you live in Dickinson County in Michigan, you know what physical therapy does, because we told you over and over again. We had wellness fairs. When I was out in Montana, every month at the library, we had a wellness seminar open to the public. Physical therapist treatment of headache, open to the public. Folks would come in, we'd have coffee out for them. We talk about everything you and I just talked about. Dude, just do it. Everyone's like, hey, Jeff, how can I maybe just do it? You know? So I struggle because all the mediums are there. All the mediums are cheap. All the information is there. And the only thing missing is the actual doing of it. And so, Will, I don't know what to say, man. And I don't know why we hang back in the weeds, yet we'll complain to each other on Twitter ad nauseum that we only see 7% of back pain. Well, dude, what do you expect when you haven't told people what we do, you know? And so I don't know, man.
I know. I've got a great idea. We are going to start Jeff Moore enthusiasm, passion courses to teach people how to be as enthusiastic and as passionate as you, my friend. Because
I think those are overdue.
People could feel that energy right now. I'm ready to go get on Twitter. I'm ready to go just shout out the window and say, hey, you got to go see your physical therapist, get conservative treatment. But
that's it, man, because it's not about us. It's about them, man.
Exactly.
Like I'll never forget that John Childs article in 2006, you know, when they reran some of the data from 2004, and he showed that not receiving spinal manipulation when you were appropriate for it increased your chance of a worsening in disability after 1 week by 800%. After 4 weeks, you know, both 1 week and 4 weeks, right? 800%, 400% accordingly. Yikes, man. Like you and I both know about back pain. Once it's been around for a month, things are starting to get kind of squirrely, right? That's when you're starting to miss time off work. That's when you're on long-term opioids. That's when everything is going, that's when you're getting that first MRI or CT scan. That's when everything is going down that route of persistent pain that we're seeing so many good individuals suffering from. And why? Because we undertreated. Because we didn't get our hands in there. Because we didn't say, I can fix that problem. I can do it. Give me a shot, doc. Give me a shot. I want a chance. I can help that person. Because we're not aggressive enough. People suffer. And Will, I'm not okay with that, man. I'm just not. That's on us. That person walking down that path, the best way to get your second back surgery is to make sure you get your first one, right? And the best way to get the first one is getting the MRI tube. And if we don't keep people out of it by educating them, that's where they wind up, man. And I'm just not comfortable with that.
What do you say then? Man, wow, I could not agree more. I think that two things come to mind from what you just said there. One is absolutely right in that we have to take responsibility for what we are capable of and the services that we're able to provide. I think too, though, you know, also not forgetting that awareness is key with patients, someone who's suffering out there, that they also have a say in their care. You know, you don't have to accept that surgery or whatever is a first option. You can ask, and that's being an active participant in the system, because it's not always the case that you think of physical therapy or conservative treatment first. Your initial thought is go to your physician, and sometimes they might be more, you know, here, let's just go down to a different route and not do the conservative treatment. So, you know, if you're listening to this and you're having questions, I think one thing to emphasize, and I don't know how you feel about this, Jeff, but I would say definitely, you know, be an active participant in your own healthcare. Advocate for yourself as well. I think we have a responsibility for sure. I think that that's something that, I don't know, do you agree with that?
Yeah, I mean, once you have the knowledge, now it's on you, right? So
Yeah.
Our job is to educate you, but once we do educate you, it's about finding that inside of you that you want to be a part of an active piece of your rehab, right? I mean, a lot of us are unfortunately prone to that seeking out of that passive care, to have the pill or the scalpel fix us. And I think that what we all know is that nothing ever worth getting was not hard fought.
Yeah.
Nothing. And that goes to alleviating musculoskeletal pain like it goes to anything else in life, right? If it's going to be a truly rewarding journey, you've got to be a part of it. You've got to have chips in, man. You've got to have energy in. So, I mean, and the cool thing is anybody willing to say, you know what? I want to be an active part of my rehab. I want to participate. I want to become informed. I want to put energy in. Physical therapy wants to come alongside you. We are a profession built to meet you right at that moment when you decide you want to be better than you were a month ago. Not just get rid of this pain. You want to be better. You want to stand stronger. You want to do more. You want to thrive more. That's what we do. Right? And if you understand we do that, give us a call. Give me a call. Give Will a call. We want to come alongside you. This is what we've trained our whole lives for, was your moment of rising up. And we're not going to let you down.
I got to come up with some music and put this on like a motivational video. This, this
It's
is
another
gold.
Tuesday, man.
This
Yeah.
is gold. Tuesday at 10:30
Yeah.
p.m. Eastern time. Who would have thought?
Yeah.
Um, I was going to say, so part of why we started this, and I think what you just said ties in perfectly about having that energy rising up and taking responsibility, taking an active part in your growth. I want to pick your brain for a few minutes just about what has led you to where you are. I think that part of why we did this was to meet other successful people, other as in we're not there yet, but successful people that we aspire to be like, and not only from a incredible clinician, but the initiative that you show, you teach courses, you are very active in social media. You're not afraid to put your opinion out there. What drives you?
Well, first of all, let me say you guys are beyond successful, right? I mean, you're successful the day you decide you want to live that day well, right? That day you want to make a difference, right? It's not about how many of those days. It's about when you hit that point where you decide you guys want to start a podcast and help to inform people so they can live better lives. That is success by my definition. So you guys are already there and well beyond. What
Thanks.
drives me, Will, man, what drives me is seeing the opposite, right? What drives me is seeing people who don't get well informed, who say, yeah, I had back surgery. Yeah, John, what'd you have done, man? Yeah, Jeff, I don't know. What do you mean you don't know, John? Well, I guess I never really asked, or I never really understood why we were doing it. How you doing now? I've been in pain for 2 years. I'm off work. I'm Jeff, I'm struggling. That hurts, Will.
Yeah.
That hurts, man.
Yeah.
And you see those stories, and that's what drives me. I believe if we get a shot at the front end, I believe if well-trained, enthusiastic, motivated, empathetic, compassionate PTs who have a spirit of service and humility get a shot at the front end, we can change John's life. I bartended for years, Will. And what I loved about the profession was that people would come in struggling. And they would walk into your bar and you'd put that napkin down and you'd say, you know what, man, have a seat. What's going on? You know,
Yeah.
and give them a smile, you give them a cocktail. But more than that, you'd involve the folks around you. You'd involve the vibe of the restaurant. Sure, you'd use food and drink to your benefit. But Will, the idea was very simple. They were going to walk out of that restaurant and they were going to hop into that car and the rest of their day was going to go better than it had when they pulled up. Will, it's the same thing for me with PT, man. I want a chance early to change people from going down a bad path. I want people who are struggling a little bit to give us a chance to not have them make bad decision after bad decision that actually ruins their life. And that's not an overstatement. I mean, we see the long-term use of opioids. We see the long-term outcomes of bad. I am not being dramatic here. I am saying I have seen that too many times. And whatever it is inside me wants a shot at John. Wants a shot at John right before that MRI tube to say, John, let me show you a few things. Let me come alongside you. Let my buddies come alongside you. Let my crew come alongside you. And let's not let things go that direction. Man, I want to make a difference while I'm here. And it seems like that might be a spot I can do it. So, that drives the teaching. It drives the clinic. It drives everything. And, fatigue doesn't seem to be an issue because what we do is dramatically rewarding. Every day we're fueled up by people coming and saying the emails we get. I played golf with my wife. I took a walk with my dog, man. Dude, this is a big deal to these people. I'm not tired, man. I'm not tired. Not if that stuff's coming at me. And so one day after another, it's one thing after another that drives everything that you believe in, everything we believe to be right about the human spirit, about the way we can change the condition, about the way we can change the system. And dude, I'm going to throw everything I have behind it.
Man, seriously, somebody's got to start the motivational music anytime. I got to figure out how to do this like simultaneously when you just get on one of these and just get the music to kick in. That was incredible. So what I wanted to ask though too is that people, so anyone who's out there who knows you with your, I guess through social media, if they've had the fortune to have worked with you at one of your classes or been a student or fellow physical therapist, you name it. People see you as, I'll just give you my first impression. This guy does a lot. He puts himself out there. He's working a lot. And what I wanted to ask just from a personal standpoint, and I think it really applies to patients that we see, and maybe it's something you've always had and you take for granted, but what goes through your mind when you have those doubts of taking action? I imagine there are plenty of patients out there, people out there who are just kind of afraid of finding out, well, maybe there is something going on, or there is this fear, right? We have fear of anything, of starting I'm sure there was some doubts about starting a clinic, about starting a class. Am I capable of teaching for the first time? These kind of thoughts. I think these are things that we vastly overlook in life. I think it's something I'm personally fascinated by in learning about people's psychology of what I call doers, people who are able to overcome that and do. And it's something I would love to be able to instill into the general public and population about taking that active role, taking that step of just, even if it's not what you expect, there is learning in that action. Have you always been that way? Someone who's always taken action. How do you get through those times where you kind of doubt yourself?
Well, yeah, maybe there's always been some of that, perhaps. I've never been a real fearful person. I've always been a passionate person, and those things maybe seem to come together. But I guess for speaking to the audience, speaking to our peers, speaking to each other, when is the last time that you deeply self-reflected and believed wholeheartedly in a cause, a mission, an organization, and you put yourself out there to help it, and that went drastically wrong? The answer to that is never in the majority, right?
Yeah, no,
Right?
that's
Yeah.
completely agree.
And so, man, it comes back to self-awareness and self-reflection. And if you're honestly looking into yourself and you say, I believe in this, I believe in these people, this company, this cause, this intervention, I believe in the ability for this to make the world a better place. And you throw your heart behind that. The ROI, the risk benefit ratio to that is fantastic, right? And because the funny thing is, there literally is no risk, Will, because at the end of the day, man, isn't that what it's all about? It's regardless of the outcome's irrelevant. The outcome is actually by far the least important part of the story. The question you're going to look back and say is, when it came to the fork in the road, when the challenge was there, who was I? Was I someone who acted upon what I believed in the presence of my fear, in the presence of my uncertainty? Or was I somebody who went along with the pack because I wasn't willing to? That's what you're going to look back on. You're not going to look back on, and how did it go? That doesn't matter. That doesn't matter. And that right there erases all of the doubt and uncertainty. That makes it a no-brainer. If you truly embrace the fact that it's where you've chosen the fork that ultimately determines your fate, your success, your belief in the happiness of what you did, then, dude, there is no fear because there is no choice.
I'm fired up. That is probably one of the best answers we've ever gotten on this podcast, Jeff. And that's I don't know why it hits home with me. I just think it's something that I can speak from from not just my program, but school in general. I think we overlook that. As a practitioner and as a patient, we overlook that psychological importance of our mindset going into anything, like we talked about with the expectation of a manipulation or a crack. Like that is a vastly, I guess, not talked about enough in my mind, and something that I could not think of a better answer. I am so humbled to have had you on today, Jeff. Anyone who's out there, there's no way you can't feel impassioned. There's no way you can't feel empowered. There's no way that you cannot feel the energy coming from Jeff Moore. And I am so humbled to have had the opportunity to talk with you, Jeff. It's been a long time that I've hoped to get to speak with you. And so we really appreciate it. I want to give you a chance to let people know where they can find out more about you, where they can learn, keep up with you, the things you're doing. I cannot recommend Jeff enough. I'm going to be putting all of this stuff on the show notes. I'm going to be, if you follow me, I try to tweet at Jeff as much as possible, or retweet his stuff. He's one of the leading guys out there, not just for physical therapy, but about your health in general. So please, Jeff, where can we learn more about you?
Yeah, well, first, I really appreciate all the kind words. It means a ton, but I think sometimes you guys overestimate what we do. By we, I mean those who are further out of school. You guys are the ones taking the gamble right now. I mean, you're the ones getting out of school, finishing up school. You've got a lot of demands in your time, yet you're choosing to go above and beyond to launch a podcast to educate people to make lives better. Dude, at some point, you got to look in the mirror and say, who's really doing the work, But I do appreciate that. But I want you guys to acknowledge too your role in that. And if you guys don't come behind us, well, then this whole thing is shot.
Yeah.
We're all working together.
That's the beautiful thing of the field, right? I mean, I feel like that's what beyond. I think like, I don't have a study, but I'm just gonna say that way more than even just the majority. That's why we get into it. We want to help people get better, right? It doesn't matter if what I do is the best thing. It doesn't matter if someone else, whatever you need, right? And then that's, and in our experience, and we really appreciate the kind words. We are incredibly humbled to even get to talk with you and have this exchange of information, because I come from a non-science background. When I first studied international studies in Spanish, I say that to people and people are just like, how did you get into physical therapy? Right? So I come from this more humanistic background, and I notice the everyday person is just like, when I talk with another physical therapy student, we're using this terminology and people are just, what are you talking about? It's over my head. I don't get it. That doesn't always help people. Sometimes it's better to just break it down. I love analogies. We had a great podcast with Ian Manning, a golf PT, and we talked about analogies for like 5-10 minutes, just about some of the stuff he says. So I think that's why we all got into it. I imagine I didn't even ask, was that I'm assuming that was kind of going along with the bartending of why you wanted to get into PT.
Yeah, man. Yeah, like you're saying, the mission is there. The mission aligns with your core values. That's what brings you into it.
So I can't get away without you telling people where they can find you.
Gotcha. Good, man. Yeah. So I'm on Twitter quite a bit. It's at Jeff Moore DPT. If you want to track my content on there, my website is ice.physio. So www.ice.physio. I do have a .com as well, but I kind of dig the physio thing. It's ptonice.com. You're welcome to go there, but I prefer you go to ice.physio because it kind of feels good when you type it in. On Facebook, it's facebook.com/educatept. I'm a huge part of Evidence in Motion. I teach with Tim Flynn at Manipalooza every year. Teach all across the country. I teach with those guys in Seattle on Fridays. So certainly if you are in the Evidence in Motion residency and fellowship programs, you're going to get good exposure to me through those because I play a big role in that company. Just an unbelievable group of individuals moving the profession forward. So those are probably the big ones, man. If you want to go a bit deeper on Instagram, I'm at Ice Physio on Instagram, but probably one medium is probably enough of Jeff for anybody in a given day. Like you said, Periscope's probably the big one, but Periscope and Twitter kind of work together. So you can find me on Periscope and track that content. The podcast is now called PT on Ice. Okay. So if you wanted to go to iTunes, you would search for PT on Ice, and we've got, I don't know, it might be hundreds now of episodes over time that have accumulated on there.
If you're curious about anything about health, it focuses a lot on physical therapy and some of the details of physical therapy, but I highly recommend it. It's been amazing just to see the amount of people that show up when you record on Periscope. Like I'm going to work at like 6 a.m. sometimes and I get a note on my phone like, hey, Jeff Moore is live talking about blah, blah, blah. And I'm like, oh, cool. I'll probably be the only person watching him. Not that you wouldn't have people. It's just 6 a.m. Eastern time. And there's like 50, 100, 150, 200 people there and some big like people that we recognize. And that's just a tribute to you and the work you do. And
Will, I think it's not as much a tribute to me. I always laugh. People aren't following me, man. They're following the content. They're following the community. It's a group of individuals that have a lot of give a damn. And they want to get fired up before work. It's not me. It's the community of folks. And I've been blessed to have come up with that stuff. We sort of rallied around it. But at the end of the day, we're following each other, man, because it's not me. It's not you. It's all of us that are going to move this thing forward.
That's why we love Jeff Moore. He's always deflecting credit. But he's real and he's humble about it. And if you're out there listening, thank you guys so much for taking the time. Our mission is always to help create a healthier, more informed society, allow people to have a more active choice in their health, and promote a healthy lifestyle. So thank you so much again, Jeff.
Sincerely appreciate the opportunity.